Hi. So welcome to my recording for my drug policy analysis. I chose prior authorization requirements from the list of possible topics because I have some personal experience working in a clinic where I had to request prior authorization. And it was not for psychotropic medication. It was for finding access to post-exposure prophylaxis for individuals who may have been exposed to HIV. And I was working at a sexual health clinic at the time, and I think prior to or very close to the FDA approval of PrEP, Truvada for PrEP. And so the reason why I needed to get prior authorization for that medication for individuals who are seeking post-exposure prophylaxis was because with individuals who had certain types of insurance, that class of drug, it was being used off-label for post-exposure prophylaxis according to their formulary. And anyway, it's just to say that gaining that prior authorization was an administrative burden, and I think from a clinician's standpoint, it was something that it was like red tape. It was something that we had to do. I think from a patient standpoint, it's an anxiety inducing. It's like when you can't get the medication that you really need, and when it's time sensitive, as was the case with that particular medication. Yeah, a lot can come up. It's a really tense situation, and you just want to get the medication as soon as possible so that you can, go about your life. But in this case, I am looking at psychotropic medication and prior authorization requirements for psychotropic medication as it pertains to adolescents and children who are trying to get the medication via Medicaid. And I found a few sources that I will share. And the sources that I have that are talking about psychotropic medication being prescribed for children and youth enrolled in Medicaid say that it's usually prescribed for those children and youth who have serious behavioral health needs, and children in foster care are at particularly high risk for being prescribed these medications. And so nationwide, concerns about inappropriate prescribing of psychotropic medications has led some state Medicaid agencies to develop prior authorization processes that establish greater oversight for these medications. Prior authorization of psychotropic medications requires that under certain circumstances, a provider must obtain pre-approval to prescribe a particular medication in order for the Medicaid program to cover the medication cost. So let's see. So prior authorization processes are intended to change prescribing patterns and are typically designed to both increase the receipt of clinically appropriate care, as well as decrease the expenditures associated with the inappropriate use of psychotropic medications. So yeah, I was able to find information on various states that have prior authorization requirement for psychotropic medications. And there's an organization that has a website that I'll share my screen really quickly here, that's created a nice little graph of sort of a makeup of all of the prior authorization requirements for various states in their Medicaid agencies. So That's not what I wanted. No, no. Uh, no. One moment. Here we go. Okay. So yeah, I just wanted to show you, and this is from the Center for Healthcare Strategies, Inc. It's a nonprofit. So they are showing that, in the left column, you have the state agency and program, and then in the right column, you have the prior authorization parameters. Starting at the beginning in California, you see that prior authorization is required for children age 18 and younger who are prescribed antipsychotics, and polypharmacy, concurrent use of 2 or more antipsychotics for children age 18 and younger. So it looks like mostly just centered around antipsychotics in California. But as you can see, moving forward, just down the list right here, the Illinois Department of Health and Human Services, prior authorization is required for children age 6 and under who receive medication for ADHD and atypical antipsychotics. Yeah, there's just a whole list here. So again, that's the Center for Healthcare Strategies. It's a nonprofit health policy resource center dedicated to improving healthcare access and quality for low-income Americans. So I will stop sharing. Bear with me one moment. So I wanted to talk a little bit about the impact that prior authorization policies have on clinicians and on patients. And as I said, before, sort of in my experience of working in a clinic setting, and having to get prior authorization for patients who needed the medication very quickly, it's anxiety inducing. And yeah, I think that it kind of diminishes the overall quality of patient care when a client cannot access the medication that they need right away. From a counselor's perspective, from a clinician's perspective, it really does increase administrative burden. It felt like I was having to sort of wade through a lot of red tape. I think that there is a possibility, if a clinician has limited time and resources and needs to request prior authorization for a medication, they may be looking into alternatives to that medication that they wouldn't have necessarily sought after. I will cite a study by JAMA. There's a 2015 study by Schmidt et al. And talks about sort of the potential unintended consequences of restrictive policies. And those include inadequate treatment, substitution of potentially inappropriate off-label psychotropic medication classes, such as anticonvulsant mood stabilizers and antidepressants, and administrative burden on prescribers. And in that same study, it says that Medicaid oversight programs should be concerned not only with unnecessary antipsychotic use, but also should ensure adherence to appropriate cardiometabolic monitoring practices at baseline and during antipsychotic treatment, and support access to alternative evidence-based non-pharmacological treatments. And um, I think that touches on one of the concerns around antipsychotic medication, the prescription of it for minors. And it is this cardiometabolic risk there. And, that really is, for anyone who is on an antipsychotic, they're looking at risk for cardiovascular diseases like diabetes. And there's just an increased risk in a population who uses an antipsychotic. And I think that's, one of the main reasons why there would be sort of these prior authorization measures put in place. And then finally, I guess I'll go into a study in 2014 that actually did look at rates of prescription for it says two mid-Atlantic states, and one state had oversight measures like prior authorization requirements, and then the other state didn't. And so it was a comparison for a time looking at these two states. And so basically, they found in a 4-year study looking at the rate of prescription that there wasn't really any kind of difference, that there was modest but statistically significant effect on the rate of prescription of antipsychotics in children between the ages of 6 to 12 years old. And so, yeah, I guess it's just to say that so far in the empirical data, there isn't really anything that shows that prescribers would search for alternatives to antipsychotic medication because there is a prior authorization requirement. So that's interesting. But, certainly, there are some unintended consequences that may pop up. And I think there can be more research on the subject. Yeah. So anyway, I just wanted to share some of the sources that I had found on the subject. And sorry if it's a little clunky, but those are my thoughts. So thank you for this opportunity to share with you some of the information that I found.